The remarkable progress in life expectancy that defined the early 20th century has hit a surprising and concerning plateau for generations born after 1939. But here's where it gets controversial. According to a recent study, none of these later generations are expected to live to 100 years on average, a milestone many once believed was within reach. This eye-opening research, published in the prestigious journal Proceedings of the National Academy of Sciences, was co-authored by Hector Pifarré y Arolas from the University of Wisconsin-Madison's La Follette School of Public Affairs, José Andrade of the Max Planck Institute for Demographic Research, and Carlo Giovanni Camarda from the Institut National d'Études Démographiques. Their team analyzed life expectancy trends across 23 high-income countries known for low mortality rates, using comprehensive data from the Human Mortality Database. To predict future trends, they applied 6 different mortality forecasting methods, statistical tools that use historical and current mortality data to estimate how long people might live under various plausible scenarios. The findings are striking. The extraordinary surge in life expectancy, seen in the first half of the 20th century, appears unlikely to be repeated anytime soon. Hector Pifarré y Arolas explains, even if adult survival rates improve at twice the speed we currently predict, without groundbreaking medical advances that dramatically extend human life, we won't see the rapid life expectancy gains that characterized the early 1900s. To put this into perspective, between 1900 and 1938, life expectancy increased by about 5.5 months with each new generation. For example, someone born in a high-income country in 1900 could expect to live around 62 years on average. Fast forward just 38 years, and that number had jumped to 80 years, a remarkable leap. However, for those born between 1939 and 2000, the pace of improvement slowed dramatically, with life expectancy increasing by only about 2.5 to 3.5 months per generation, depending on the forecasting model used. This slowdown is significant because it suggests that the rapid gains we once took for granted are no longer guaranteed. Why the slowdown? The key lies in the dramatic reductions in infant and child mortality during the early 20th century, driven by medical breakthroughs like vaccines, antibiotics, and improved sanitation, as well as better living conditions. These improvements had a huge impact on average life expectancy because saving lives at such young ages adds many potential years to the average lifespan. But now, infant and child mortality rates in these countries are already extremely low, so further reductions in these areas offer little room for boosting overall life expectancy. Instead, future gains depend largely on improving survival rates among older adults. A much tougher challenge. The study's corresponding author, José Andrade, points out, we predict that individuals born in 1980 will not reach 100 years on average, and none of the cohorts we studied are expected to hit this century mark. This is largely because the earlier surges in longevity were fueled by dramatic drops in early life mortality, which we can no longer replicate. Of course, mortality forecasts are inherently uncertain. Unforeseen events like pandemics, revolutionary medical treatments, or major societal shifts could change the trajectory. Still, this research offers crucial insights for policymakers. Understanding these trends helps governments plan for future healthcare demands, pension systems, and social services, ensuring they are prepared for a population that may not live as long as previously expected. On a personal level, these findings have important implications too. Life expectancy influences how individuals plan for retirement, savings, and long-term care. If the pace of longevity gains slows, both individuals and governments might need to adjust their expectations and strategies accordingly. This study challenges the optimistic assumption that life expectancy will continue to rise steadily and raises important questions. Are we prepared for a future where living to 100 is not the norm? Should we rethink how we allocate resources for aging populations? And what role might new medical innovations play in reversing or accelerating these trends? We invite you to share your thoughts. Do you agree with these projections, Or do you believe breakthroughs could still dramatically extend human life? How should societies adapt to these changing expectations? Join the conversation and let us know your perspective.